This is Dr. Bev Knox, and you are listening to my psychology tutorials, Learn Psychology While You Sleep. What is abnormal psychology? Abnormal psychology is the branch of psychology that studies abnormal behavior and ways of helping people who are affected by psychological disorders. The study of abnormal psychology is illuminated not only by extensive research on the causes and treatment of psychological disorders reported in scientific journals, but also by the personal stories of people affected by these problems. How do we define abnormal behavior? We all become anxious or depressed from time to time, but is this abnormal? Anxiety in anticipation of an important job interview or a final examination is perfectly normal. It is appropriate to feel depressed when you have lost someone close to you or when you have failed at a test or on the job. There is a line between normal and abnormal behavior. One answer is that emotional states such as anxiety and depression may be considered abnormal when they are not appropriate to the situation. It is normal to feel down when you fail a test, but not when your grades are good or excellent. It is normal to feel anxious before a college admissions interview, but not normal to panic before entering a department store or boarding a crowded elevator. Abnormality may be suggested by the magnitude of the problem. Although some anxiety is normal enough before a job interview, feeling that your heart may leap from your chest and consequently canceling your interview is not. Nor is it normal to feel anxious in this situation that your clothing becomes soaked with perspiration. Criteria for determining abnormality. Mental health professionals apply various criteria when making judgments about whether behavior is abnormal. The most commonly used criteria includes the following. 1. Unusualness. Behavior that is unusual is often considered abnormal. Only a few of us report seeing or hearing things that are not really there. Seeing things and hearing things are almost always considered abnormal in our culture, but such experiences are sometimes considered normal in certain types of spiritual experiences. Hearing voices and other forms of hallucinations under some circumstances are not considered unusual in some societies. However, becoming overcome with feelings of panic when entering a department store or when standing in a crowded elevator is uncommon and considered abnormal. Uncommon behavior is not in itself abnormal. Only one person can hold the record for swimming the fastest 100 meters. The record-holding athlete differs from the rest of us, but again, it is not considered abnormal. Thus, rarity of statistical deviance is not a significant basis for labeling behavior abnormal. Nevertheless, it is often one of the yardsticks used to judge abnormality. 2. Social deviance. All societies have norms, which are standards, that define the kinds of behaviors that are expected and acceptable in given contexts. Behavior deemed normal in one culture may be viewed as absolutely abnormal in another. For example, people in our culture who assume that all male strangers are devious are usually regarded as unduly suspicious or distrustful, but such suspicions are justified in certain communities. Clinicians need to weigh cultural differences when determining what is normal and what is abnormal. What strikes one generation as abnormal may be considered normal by the next. For example, in the mid-1970s, homosexuality was classified as a mental disorder by psychiatric professionals. Today, however, the psychiatric profession no longer considers homosexuality a mental disorder, and many people argue that contemporary societal norms should include homosexuality as a normal variation in behavior. When normality is judged on the basis of compliance with social norms, nonconformists may incorrectly be labeled as mentally disturbed. We may come to a brand behavior that we do not approve of as quote-unquote sick, rather than accept that the behavior may be normal even though it offends or puzzles us. 3. Faculty perceptions or interpretations of reality. Normally, our sensory systems and cognitive processes permit us to form accurate mental representations of the environment. Seeing things and hearing voices that are not present are considered hallucinations, in which our culture are generally taken as signs of an underlying mental disorder. 4. Significant personal distress. States of personal distress caused by troublesome emotions such as anxiety, fear, or depression may be abnormal. As we noted earlier, however, anxiety and depression are sometimes appropriate responses to a situation. Real threats and losses do occur in life, and lack of an emotional response to them would be regarded as abnormal. Appropriate feelings of distress are not considered abnormal unless the feelings persist long after the source of anguish has been removed. 5. Maladaptive or self-defeating behavior. Behavior that leads to unhappiness rather than self-fulfillment can be regarded as abnormal. Behavior that limits one's ability to function in expected roles or to adapt in one's environment may also be considered abnormal. According to these criteria, heavy alcohol consumption that impairs health or social and occupational functioning may be viewed as abnormal. Agoraphobic behavior, characterized by intense fear of venturing into public places, may be considered abnormal. It is both uncommon and maladaptive because it impairs an individual's ability to fulfill work and family responsibilities. 6. Dangerousness. Behavior that is dangerous to oneself or other people may be considered abnormal. Here too, the social context is crucial. In wartime, people who sacrifice their lives or charge the enemy with little apparent concern for their own safety may be characterized as courageous, heroic, and patriotic. But people who threaten or attempt suicide because of the pressures of civilian life are usually considered abnormal. Abnormal behavior thus has multiple definitions. Depending on the case, some criteria may be weighed more heavily than others, but in most cases, a combination of these criteria is used to define abnormality. It is one thing to recognize and label behavior as abnormal. It is another to understand and explain it. Philosophers, physicians, natural scientists, and psychologists have used various approaches or models in the effort to explain abnormal behavior. Some approaches have been based on superstition, others have invoked religious explanations. Some current views are predominantly biological, others are psychological. In considering various historical and contemporary approaches to understand abnormal behavior, let's look further at the importance of cultural beliefs in determining which behavioral patterns are deemed abnormal.